Welcome to the 7 days of Nclex success party. This is the night shift. I am so excited to be here with my handsome co-host Mark Callion. We are going to be conducting this night shift Nclex party. We have real REMAR nurses who just passed Nclex, and guess what? They have the inside scoop for you on how you can be successful
and we are here to celebrate their success and also let you know that you are on the right path, preparing for Nclex, incremental steps, guys. We have some amazing questions to get you started. Let's go.
First question right here. Question number 1, when helping a client who is recovering from a stroke to walk, the practical nurse should assist. Is it 1, on the client's strong side, 2, on the client's weak side, 3, from behind, or 4, with a wheelchair? I'm gonna read that again for my REMAR nurses.
Put your answer 1, 2, 3, or 4.
Here we go. When helping a client who is recovering from a stroke to walk, the practical nurse should assist, number 1, on the client's strong side, 2, on the client's weak side, 3, from behind, or 4, with a wheelchair. Which one is it? This is 7 days of Nclex success party. Come on in, put your answer. I got real REMAR nurses. I wonder if one of them can answer this question.
They've been there. They've done that. They've passed Nclex.
What do you guys think it is? Go ahead, put it on the screen. Smash that share button. I see a lot of 2s. The correct number is actually number 2. Good job, guys. The correct answer is number 2. You got it right. Because the client has trouble walking, the nurse, the practical nurse, the registered nurse, the assisted personnel, whoever is ambulating that patient should stand on the weaker side, right? Some people picked the strong side, but think about it. If the client has weakness on this side, but the nurse is over here, if the client starts to fall, the nurse is going to do what, Mark? Mark, what's the nurse going to do? What are you going to do?
Try to help them?
Yeah, you gotta pull. Yeah, you gotta pull me. If you're not over here to help me, then you gotta yank me back, and it could hurt me. All right.
Yeah, that sounds painful.
Great job. I got another question for you guys. Let's try this one. Question number 2. A nurse is caring for a 55-year-old male with a history of left side heart failure. During a routine assessment, the patient develops acute dyspnea with cyanosis and pink frothy sputum. Goodness. In addition to administering oxygen, which of these prescribed actions should the nurse take first? Number 1, obtain an arterial blood gas. 2, suction the client. 3, administer bumetanide IV stat. Or 4, contact respiratory therapy to administer a nebulizer treatment stat. What do you guys think this is? What would you do? What is your priority, guys, here? Your patient, they have what? They have heart failure, left side. All of a sudden, they start to get short of breath, acute dyspnea. They start to have pink frothy sputum coming up, and the doctor tells you to put on oxygen. Of course, put on oxygen. But then what should you do next?
Hold on. So we're seeing a lot of different answers here. We see
a lot of different answers,
2,
huh? Oh, yeah.
3.
A lot.
See 4. Let's see. What else do we have? Karen says 2. Tug says 3.
A lot of people saying suction the client. Some people are saying administer that bumetanide, contact respiratory therapy, because they know what to do, right?
I don't know. You know what? Let's make this one a giveaway.
Okay, giveaway?
Yeah, let's make this question a giveaway.
All right.
So we have, let's see, we'll do a $25 gift card. $25 gift card to whoever gets this one right, and we select. All right.
Okay.
So listen, if you're not selected, no hard feelings, guys. Let's celebrate the people who are.
Okay.
The person who is.
So we're gonna pick somebody.
Tell me what the answer is. Go ahead and whisper that real quick.
Okay. The answer is.
No, they can hear you.
No, they can't. All right. I'm wearing a microphone. See.
Hold on.
Y'all think y'all slick.
Hold on. Let me hold up the number fingers. Hold up the number.
Okay. So Mark knows it now.
I got it.
Okay. So Mark, you got to pick the person. All right.
Let's see.
So.
Oh, somebody's gonna be disappointed.
Okay. You guys know what the answer is? I'm gonna put the question back up one more time.
Read it again.
All right. The nurse.
The options.
Okay. So is it number 1, get that arterial blood gas? 2, suction the client. 3, administer bumetanide IV stat. 4, contact respiratory therapy. Which one is it gonna be, Mark?
All right. And
okay, say the winner. Come on.
The winner
3,
is
2.
3, 2.
I'm so excited.
1. I'm looking for the answer.
Are there no right answers among the group?
Here it is. Boom.
Who is it? Okay. Taisha. Nurse Taisha, you got it. The correct answer is going to be, you got to give that diuretic, all right? Because the patient has congestive heart failure. And so a lot of people are going to think that if you suction the client because they have that pink frothy sputum, that's going to work. But remember, the fluid is where? It's not just hanging out in their throat. The fluid is deep, deep down in the pulmonary system, okay? Deep, deep down. So in order to get it, you can't suction the fluid from congestive heart failure where it's building up.
Do us a favor. Go ahead and do a screenshot of your name right there. Put the question back up.
I'll put the question back up.
Screenshot of your name and that answer and send that to us by email at support@remarreview.com. Support@remarreview.com. Screenshot your name and we will verify that it's you.
Yep.
And get that right out to you. You are watching on YouTube.
Yeah.
Awesome.
Okay. So that was the correct answer. All right. What shall we do now, Mark?
Listen, you know what? While we're talking, doing these questions, I see a group of nurses that are looking like, you know what? I remember those days.
Yes.
I remember logging on, doing the questions with you. Mm-hmm. And so we want to bring them in and just introduce them and maybe hear one of their stories.
Okay. That's great.
All right, so in fact, let's just say hi to the group real quick. We're just going to start adding everybody in.
Oh, my goodness. Look at these lovely ladies. Look at them. Oh, these are Remar nurses, y'all. Y'all are looking at promises fulfilled right here, here with you guys. And I am so excited. Everybody give a wave. Let them know that you're here. Oh, that's what success looks like. Everybody watching, put congratulations because these ladies are all newly licensed. Look how happy they look. Don't they look so happy? They look relaxed. Like I ain't got to answer no more of them questions that Regina putting up.
How many of you guys remember doing questions with Regina on the Monday motivations, on the events, on the lives?
Yep.
Man.
So they started where if you guys are watching this, they did the same thing I did. So you're on the right track. Stay on the right path. All right, let's start with Nurse Alexis. Hi, Nurse Alexis.
Hey, how are you?
I'm doing good. I need you to speak up really loud so everybody can hear you, okay? So, Nurse Alexis, you were a repeat test taker, is that right? I can. Yeah, I can hear you better. Okay, so I was saying you were a repeat test taker, and when you were doing your video, I kind of wanted you to just talk about what was the biggest challenge you had to overcome.
My biggest challenge was really sitting down studying.
Yeah.
Really studying, but because I took it the first time last August, but I didn't. I didn't pass it. I was pregnant with my little boy, but then in June I got sick with COVID, so I was locked up for like a month.
Wow.
So I was like, I might as well just sit and study, and I finished the virtual training while I was in quarantine.
Wow.
And I was nervous about it. When I took my test in July, I came out quarantine like a couple of days before. I was nervous, but I remember one of your quotes you said, think you say you going to pass the Nclex. So I said it right before I went in. And my questions cut off. I was in there maybe 40 minutes and it cut off at 60.
Wow, the minimum.
So the minimum.
That is amazing. That is amazing.
Can we just pause and give God the praise for that? I mean,
yes.
Under quarantine.
Yep.
Wow.
And you know what? That is amazing because sometimes when things fall upon us, we think, man, this is bad. But God can use He can use anything for his glory, honestly. And so you had COVID, and I'm so glad that you are here and you're speaking and you're recovered. And it actually it sat you down. It sat you down because that one of your biggest problems to overcome was studying. So it sat you down to study.
Because I can study.
Yeah.
Because I didn't really study the first. I was real sick, so I was just like, I just went in and took it. I kind of felt I didn't pass it, but when I didn't, it made me real down. So I'm like, so I bought your I had a quick Facebook. I had been bought that, but I didn't study it. But I had studied. I finished that, made flashcards. I just studied and prayed, and I passed. Thanks to you all.
Oh my goodness.
Wow.
Thank you so much. I thank you so much for taking time out of your busy nursing schedule to come back and talk to us. I'm going to put you down and bring you back later. But I want to bring up another nurse for me. Whoever it is. Oh, Nurse Brittany. Hi, Nurse Brittany.
Hi.
How are you?
Great. How are y'all?
I'm doing so good.
Congratulations on passing Nclex.
Mm-hmm. Getting married, moving into a new house. Like, I remember your testimony where you said you had all those things going on the first time you tested. So you were a repeat test taker too as well, right?
Yes.
Yeah.
Yes.
So I have questions. Oh, so much. Your testimonial was so good. You talked about a scripture that Mark did that you took in with you, 2 Timothy 1:7. How much did the virtual trainer help you get on course with your studying?
It helped me a lot. Most definitely having a guided schedule was right where I needed to be. I just broke it down, did a little bit every day. And, if I felt like I couldn't do everything, I just did what I could do. But I felt like the virtual trainer was God sent. It really helped me a lot.
I'm so excited, so happy. I'm so excited. I'm so happy.
Were you able to stick with your schedule pretty well, or was it challenging? How was that?
It was a little challenging getting on board with it, but I like the fact I'm an organized type of person, so I like to have that guidance to get me where I need to be. So it really did help to be able to follow the schedule, and I tried my best, even though I was working and being a new wife. But I tried my best to stick with it. If I didn't finish it, I made sure to do it the next day and just keep pushing forward.
Yep. A lot of nursing students struggle with getting everything organized, like you said, and knowing what to study on what days and how long they should be studying. So I'm really glad that the virtual trainer solved that problem for you during the process. So how good does it feel now to have your nursing license?
It feels so good. It feels so good. It's a weight off my shoulders. I just spent so much time studying and trying to make sure every day is like, oh, I got to get home. I got to study.
Yep.
But now that it's done, I can just kick and put my feet back and relax.
So let me say this. The virtual trainer is on sale now. What's the price, Mark?
Right now it's $189 for the full package, $169 if you have that quick fax book.
So it's $189. Tell me, how much would you pay for it now that you have your nursing license?
Knowing the results.
I would pay that price again. If I had to pay $300, $400, I would pay that.
Yeah.
If it helped me to pass, I would pay whatever I had to pay because it's guaranteed to help you to pass.
Absolutely. I just wanted to put that in perspective because I see you now as a nursing, you're actually a licensed nurse. And so sometimes nursing students need that just word of encouragement to make the investment in themselves because that's what you're investing in. So I loved your testimony. I wrote so many notes about all of you guys, but I just loved how you said you liked the short videos, the schedule, and all those things really helped to put the dots together for you.
Yes, it did.
That's awesome. That's awesome. Just stay by. We're gonna have some more questions for you.
Yep.
Right now we're gonna keep going, and I think let's do some more questions.
Okay, let's do another Nclex question. You guys coming up. I might ask the Remar nurses here. Here's the next one right here. A nurse is reviewing an elderly client's chart before giving medications. Which new client information should be reported to the physician first? Is it Number 1, chronic constipation. 2, low serum albumin. 3, increased body fat. Or 4, thin, dry skin. All right. So we're talking about an elderly client's chart before giving medications. What new information should be reported to the physician first? Is it number 1, chronic constipation, 2, low serum albumin, 3, increased body fat, 4, thin, dry skin? What do you guys think? What are you thinking here? What are you leaning towards? What makes you worried? What makes you worried, or what concerns you as a nurse? Okay, what answers are we seeing, Mark?
1, 2, 3, or 4. Let's see what we have so far. Let's see. We have 4. We have 2.
Lots of different answers.
Lots of different answers.
I'm so glad you guys are here, because remember, you get them wrong here. That's okay. I don't want you to get them wrong when we take the exam.
That's true.
Let me show you the right answer. Okay, let's see.
Before you do.
Okay.
Let's see. Is this question number 3?
Yep.
3 out of, okay. Let's see. Let's make this one also.
You want to do another giveaway?
I think we can do another giveaway.
Okay.
Let's see. I think we can do another giveaway.
All right.
What should we give away?
I don't know.
I know.
What do you want to give away? Okay.
Let's give away. You know what?
Okay.
I'm confident that the nurses, the Remar nurses that are watching, they have the virtual trainer, or they're going to get the virtual trainer. They're going to pass Nclex, and then there's a resource that you wrote to help them after they pass Nclex.
Okay.
By the name of what?
First shift.
First
shift. Okay.
This is how to
dominate. This is how to dominate
your first 2 years of nursing.
I was going to how to
pass Nclex.
Yeah, I was how to pass Nclex. This is how to pass your first 2 years of nursing without
the doctor yelling at you.
Or just
without
making
not
a
getting
mess.
the rate that you need.
Without getting a bad report from your patient.
Exactly.
Yeah.
Exactly. So we're confident. We're already looking past Nclex. I mean, we have it down to a system, and we see the testimonials. So we want to help you also after as well. So,
okay. So who's gonna win first shift?
What's the answer?
You want me to tell you? Okay. You want me to? Okay. Okay. The answer is there, right there.
That's it, right there.
Yeah.
Are you? How many? What?
Oh wait, I'm sorry. This is the answer.
All right. Okay.
Here we go.
All right.
Here we
Let's
go.
see. Okay. All right. If you have your answer, go to put your answer one more time. Go to put your answer one more time, and I'm gonna select. Let me see. I'm gonna select. I'm gonna select.
Lots of people are like, oh yes, some
right,
2s, some 4s, some 1s. Remar nurses, what do you think?
2, 1. Here we go.
Okay, that's the person you picked.
That's it.
Okay, listen, this is the right answer. The right answer was number 2. Erica, you got it right. And I love that nurse's uniform you're wearing. So low serum albumin, this indicates that the patient is not going to have a lot of protein binding ability, right? Their muscle mass, their protein is not going to be adequate. And so this will lead to some polypharmacy interactions, possibly. This is not great for our patient. All right. So this is the first thing that we will report. Did you guys get that one right? Was that a tricky one?
Congratulations, Erica. Go ahead and screenshot your name in this image and send it to support@remarreview.com. Support@remarreview.com. We'll get your copy of First Shift.
Perfect.
To you right away.
Yep. All right.
And also, everybody that orders the Nclex virtual trainer during the 7 days of Nclex, what are they going to get? You
also get the first shift, even if you didn't win it tonight. If you order the VT this 7 days of Nclex event, you will get the first shift sent to you for free.
So order by January 1st, and I think while supplies last, guys. So make sure that you get on that. You get your Nclex training and also how to dominate your first 2 years of nursing, because we want to make sure that you are an intelligent, a competent nurse that's able to rise in the ranks and do your thing on the nursing floor.
All right. Okay. So, and get it. And I want to say this too. If you guys are ordering the VT during this event, order on day 1 instead of day 7, because we get so slammed with orders that I know we'll be doing them next day, as much as we can. So if you want to get your books the fastest, order beginning of the event.
And P.S. if you've heard anything about the Postal Service and the questionability right now, listen, we're getting everything out super fast. But you don't want to be waiting and wondering. So order right now, remarnurse.com. All right.
All right.
So who can we talk to now?
I don't know. We have And we have Treasure, we have Valita, we have
Sean. Let's go with Treasure. She's waiting.
Treasure.
She's waiting. We're gonna bring Treasure in. You ready?
Yes.
All right, here we go.
I have some questions for Treasure. How you doing?
Hi.
So you're a repeat test taker. Tell me, how did you prepare the first time around you took your Nclex?
I'm gonna be honest, I didn't. As I told you in my video, I got 5 small kids. My oldest being 10, and I was going through a really bad divorce and trying to finish school. So once I finished, like forget it, I'm gonna just go and I'm gonna take it. But it took time because I was working, trying to keep my bills, trying to keep the kids in daycare.
Yeah.
So I remember I asked somebody, and I was like, "Well, what's a good resource?" And the girl told me she's gonna nurse Remar. I came on YouTube and I was looking at videos from time to time. I'm in there changing the people. I got my AirPods in my ear. I'm trying to listen. So when I went and I sat the first time, I was like, I hear her, but I didn't take my time. But it was a couple things that I remember you saying that I knew I got right.
Uh-huh.
I went the second time, I did my binder, I did my virtual trainer, and just listening to you and writing along in the book helped me so much. When I sat down the first time, I had to get up. I almost passed out. I was not breathing. I was just sitting on like, I was not like
wow.
And then I prayed. I didn't tell anybody. I got up that morning. I had just reviewed a couple of your videos.
Mm-hmm.
I said, "Mama, where you going?" I said, "To a job interview." And he was like, "Okay, I hope you get it." And I was like, "I hope I get it too." And as I was closing it, I was sitting up there crying. I cried here to Charleston, which is like an hour away. And when I sat down, I cut off at 85.
Nice.
I got up. I said, "Yeah, I passed." But everything told me just sitting there, I never had to second guess. Never had to second guess because you did it. You everything was there.
Oh my goodness. And I love your story because I want people to watch this and know that you guys are real people with real lives and not just like regular lives. I mean, but like our nurses for Remar, you guys are amazing. Like you have 5 kids. Like anybody who has one child knows how difficult it can be to do anything, right? And so you were able to incorporate the virtual trainer into a very busy life. Like a very busy life and able to have success. And I love your binder. I wish you could show everybody. I don't know if you have it, but you had this like pink binder that you have created. And it was just amazing.
It was so cute. I was like, "Oh, I'm gonna make my whole thing." I was ready. I said, "She gonna get me through this thing." And it was awesome. I'm telling you, if I had to pay $500, I would have paid it. Like when I go through for my RN, I'm gonna pay it because I know 100%. Had I used you the first time, I would have passed.
Oh my goodness. Wow. So thank you so much. Thank you so much. Man.
Awesome. Man. So when you were going through the program, did you do it like from your phone, laptop, or what did you use most often?
Most often I had picked up like 16-hour shifts, so I would do like my 11 to 7s. What I'll do was I'll get all my stuff. I will pick up 16 hours.
16-hour shifts.
Mm-hmm. So I would do like 3 to 11, 11 to 7. So what I would do on my 11 to 7, once I made sure everybody was down and in the bed and did my rounds, I would sit with my laptop into the break room. And my nurses knew, and I would just study. I put my headphones in and I'm going along with the virtual trainer.
Wow.
And on my days that I had off, with the COVID, the kids are on the computer. So in order to help them, I would be like, okay, this is what I'll do. If y'all have to be on the computer, I'll be on the computer all day. So for 8 hours a day, we was on the computer together. We even had the twins a little computer. They sitting down, like I said, they're 3. They're sitting down, they looking at their little good morning songs and stuff. And I kind of did it together with my babies. So it was easy. Once I got my schedule and I printed out.
It was
easy. Somebody needed to hear that because somebody right now is working 4-hour shifts and they're like, I got to quit my part-time job. Somebody's doing 8 hours. Like, I don't know how I'm going to get it done, but you were pushing 16 with the little ones and everything. And I mean, that's as real as it gets, Yeah. That's amazing. God.
Yeah, Treasure, you're awesome. And I'm very proud of you. I am so proud of you. All of you guys that are on here tonight, I am so proud because everybody has a story. And I just hope that we're able to express our gratitude and our appreciation because I know you guys have many different choices. You have so many choices when it comes to studying for Nclex. And Mark and I are really grateful that you chose to study with Remar.
I'm grateful for you. Thank you. I don't think I would have gotten as far because I did use other resources, but I want my money back. You can have it. I promise you.
Tell you, I don't know. Can you call them and say, Treasure needs her money back?
I don't know. I don't want that kind of heat in the streets, man.
Okay. Well, listen, stay tuned, Treasure. We have something better for you also.
We do. We have something special for you.
Absolutely.
Alrighty.
Don't go anywhere.
In fact, you guys that are watching right now, we want you to, once you pass Nclex, we're confident that you will pass Nclex. We want you to join the party at remarnurse.com/party to tell your story, to share your testimonial of what God has done for you and how you made it over. And that'll help encourage the next nurse and bless somebody else as well.
Yep.
Praise God.
So we have 3 more nurses we haven't talked to.
Let's talk to
Rashawn, talk to Brenda.
Let's see. Who would you like?
Rashawn.
There we go.
Hi
Let me unmute real quick.
there. Okay, hold on. We got you.
Let's go again.
Hello. Hi.
How are you?
I'm good. How are you? How are you guys?
We're doing so good. We're so happy to see you.
I'm happy to see you guys.
I'm happy to see you in your blue shirt.
Me too. You made it.
That's my shirt.
Yes. What does it mean to be a Remar nurse to you?
Oh my gosh. It's awesome. This is not my first time or my second time. I've taken this test 3 times already. So the first time I went to take it, I used other resources and then I rushed to take the exam. But the second time I completely I said, I'm going to do this. I saw Remar, but I couldn't afford it at the time. I really couldn't. I was struggling working. I'm a single mom. I have 4 kids, single divorced mom, 4 kids, 2 grandkids, and I'm trying to keep it together. And I just couldn't afford it. So I was just watching the videos on Mondays, and anytime I could catch a little piece, I was just watching it. So I said, I promised myself when I could afford to get this thing, I'm going to get it. And so as soon as I put the money aside, I got it, I paid for it. And then every day I had this book memorized every single day, memorized. And it was just so great. So I was so proud when I could say, I keep seeing all the other nurses on Mondays, on motivational Mondays, and they were getting their little roses. I said, that's going to be me. I'm getting my rose. And I did. And I was so excited.
Wow.
So when you purchased the virtual trainer, I mean, your funds were low. They were on E.
They were beyond E. I had the brokefunds.com disease. I had nothing, but I pulled it together. Every little piece I had, I pulled it together. And then when the virtual trainer went on sale, I said, I don't care. I am getting it. I couldn't wait. I just couldn't wait.
Yeah.
Praise God.
Yeah. God. So, okay, go ahead.
Sometimes we tend to brush over, but you said you used other resources. What did you use previously when you were preparing?
Well, when I was in school, they push you to use ATI when you're in school.
Sure.
I used UWorld, and that didn't work for me either. And then everybody was throwing things at me. Oh, try Hearst. Oh, try what's the other one? Mark Klimek. Oh, try it was another one, nursing.com. It was so many different resources.
Yeah.
It was so hard you can't use so many different ones because everyone does something different. You need to just stick to one. And I'm telling you, Remar was the one to stick to. I used the virtual trainer, the quick facts, did the questions, listened every single Monday. I don't care if I was at work. I don't care if I was at home. I don't care if I was sleeping. I switched to night shift. So I didn't care if I was sleeping. I woke up at 12 o'clock, at 1 o'clock, so I could make sure I heard everything. So don't use a bunch of different resources. Stick to one thing.
Wow.
That determination, that's like a common thread that we're hearing.
Yeah, all of the ladies on here tonight, they're just like, oh, this had to get done. This was just my time. I had to do it. Yeah.
So why is it important to stick to one resource or to just, study with Remar as opposed to, gathering something from here and from there? Why does that matter?
Well, I think, the biggest thing is that the system that you're studying with should follow the complete test plan. And if you're using multiple different systems, then you might be getting a portion of it from here. You may not be getting a portion of it from another resource. And so really when I'm listening to you and all the things that we provide, we have resource just within our program in order for you to get a complete picture of what you need. So man,
absolutely.
Yeah.
And even the test bank looks just like the Nclex. So
yeah.
If you when you take this Nclex, anyone who hasn't taken it yet, when you sit down and you take your questions from the test bank, it is exactly mimics the Nclex. Exactly. So if you want a preview of what the Nclex is like, use the test bank.
Oh man, that blesses my heart.
Yeah.
To hear you say that.
Of, work into that to making sure that that when students use the virtual trainer and then go into the question bank, that it has that look, that feel. But not only the look, but like the question difficulty.
Yeah.
Of
your questions are much harder. I can tell you that.
That's what I wanted. And I was going to ask you that too. I was going to ask you, when you're doing the virtual trainer, how does it feel when you get something wrong and the virtual trainer doesn't let you move on? How did that make you feel?
I felt like at first I felt like kicking myself, because I was like, wait a minute, I should have got that question right. And I kept going backwards. But it was a good thing because it made you go back and reread. And I'm a, what do you call it? Kinetic learner. I need to see it, touch it, feel it to be able to know it. So I had to keep going back over and over and over again, just so that I can get it right. And I must have, if you go back over my report card, I must have did the same questions over and over and over again until I got 100. I wanted to make sure at 95, I wasn't satisfied with 95. I wanted 100, and I kept going back over it again and over it again and over it again until I got
that. I like that. Yeah, I like that.
And that's what she's describing is like, building her confidence by studying the content.
Yep.
Some of the people are in the comments asking, like, have anxiety. How do I get over that?
Oh, I need to
how do I get over fear?
Yeah.
And what she's describing, she says, listen, I just did it again and again and again.
Yeah, that's how you
build
do
that
it.
repetition.
To
get over that, that anxiety or that apprehension. So she was ready to test. Congratulations.
And pray. When you sit down for that test, I prayed. I prayed when I got in the car. I prayed on the way to the test. I prayed when I sat there, and everything just flowed. Learning little tricks. Tricks don't work. You have to know this stuff. You have to know this stuff. And I finished this test in 75 questions. When it shut down, and then it said, now it's time for the special questions. If you want to take these special next generation questions, I was like, I wasn't even sure if it was still a part of the test or if I need to keep going. So I just kept going. And then it shut off again at 100. And I was like, oh. And then I got the same day, I called the LLR, and they told me that I passed the same day. And I must have prayed. I fell on my knees and started crying and praying. I was like, thank you, God.
Yes,
you, God. This was just a dream. This was a blessing. And Remar, I'm telling you, Mark and Regina, such a blessing. You just don't know. You really don't know.
How was your life changed in the financial sense after passing Nclex and just moving forward? Like, how does that outlook? What that have?
I could tell you, I was so glad that this happened when it did, because God does all things well. He planned this out so perfectly that I was able to get my first nursing check on my birthday, and I was able to take my own kids out, and it was so great to be able to do things for them for a change, and it just felt so great. So now I'm able to catch up on things, and they were able to have, like, when they asked me for something for Christmas, I was able to give it to them and not say, wait a minute, I got to pay this bill.
Go ahead, girl.
I'm not quite sure yet, but I don't spend thrifty because I still want to make sure I have a savings, but it feels good to be able to say, oh, y'all want to go out and eat? Okay, well, let's go. And not think about, well, maybe I shouldn't because I have to pay the light bill, or I have to pay the car note, or, something else has to get paid so we can live.
That's a good investment. That's when you invest in something and it returns it to you. So that's an amazing investment.
I mean, somebody needed to hear that like right now.
Yeah.
And you don't stop here. There's so many different opportunities for nurses nowadays. There's, even now with COVID, you can even give COVID vaccines. You can do so many different things with nursing, and you can keep going and going and going. Don't stop. I'm not stopping.
That's a word. That's a word for us on tonight. We're going to keep going. I got another Nclex question for you guys. Are you ready for it? Are they ready for it?
Let's go.
Let's see. Here we go. Next question is this. A client tells a nurse that a medication prescribed for osteoarthritis is not working. what is the most appropriate action by the nurse? Is it number 1, assess the client's headache pain on a scale from 1 to 10? 2, ask the client about the number and frequency of tablets taken. 3, notify the patient's complaint to the physician. Or 4, suggest biofeedback in combination to the prescribed medication. Which one do you think it is? Which one do you think it is? If you're next, people are like, I'm next for this testimony, I'm next for this party. Go ahead, put your answer on the screen and then put, I'm next too. All right. We are going to give the answer. You got it. I see a lot of answers on the screen. Most of them are either 2 or 3. Most of them are 2 or 3. But the correct answer is...
Before you do.
What?
Before you do.
What you
this is a party. We're going to do another giveaway.
Okay, let's do another giveaway.
This is a party. We're going to do another giveaway. So this, for this giveaway, it's going to be, let me see, not $25, but we're going to do $50 gift card.
$50.
We're going to do a $50 gift card.
I have to go buy that. Or $50 Cash App. Because they're doing it.
That's what the kids are doing?
The kids are doing Cash App now.
I don't have Cash App. Y'all pray for me.
All right.
All right. So we're going to do a $50 giveaway.
Oh, my goodness. Let me say the answer. Okay. Answer is this one.
That right there?
Yeah.
Okay.
Okay.
All right. So put the answer and say
$50.
I'm next. Put the answer and say I'm next.
Yeah, you got to have I'm next.
I want to see the testimony. I'm next. I'm passing it to that. So put your answer - I'm next. All
right. There's a question again, one more time. Client tells a nurse the medication prescribed for osteoarthritis is not working. And we got to know, what is the most appropriate action by the nurse when she receives this information? Is it 2, ask the client about the number and frequency of tablets taken, and or 3, notify the patient's complaint to the physician? What are you going to do? What are you going to do? Okay. All right. Mark is picking. All right. Mark is picking.
It's coming in 3.
3, 2, 1. Bam. It's number 2. And that is going to Keisha. Nurse Keisha, you got it. All right. $50 coming to you. Go ahead. Take a screenshot of your name. Send it to us with that name so that we can get your address, your information, or your Cash App and send that $50 to you. That's wonderful. That's a wonderful $50. There's so much you could do with that.
What would you do if you were trying to pass Nclex and had $50?
If I had $50 and I was trying to pass Nclex, I would put it towards my virtual trainer. All right. And then that would bring the price down even more. Even more. Yeah, even more.
Awesome. Congratulations. Yep. Congratulations.
Congratulations, Keisha.
Who are we talking to next?
Okay. We can talk to Nurse Valita, or we could talk to Nurse Brenda.
Let's go with Nurse Valita.
Hi, Nurse Valita. Hi. How are you?
I am wonderful, wonderful, wonderful. I just want to say thank you to you and Mark for your program. It was awesome. It truly, truly, truly helped me. I agree with you guys. You should stick with one thing. But of course, before I got to you, I had done several. Sure. And once I got to yours, it was like a big old puzzle light bulb came on and the puzzle all connected. But it was just really a great experience. I had been an LPN for about 15 years. Wow. So going back to school was hard. With trying to work, because I didn't work when I went to school for my LPN, but I didn't have a choice when it came to working with my RN.
Yeah.
So, it was kind of hard trying to get your schedule together, trying to do everything that you need to do, and pretty much go from being on the computer all day at work and shifting from that to now you got to get on the computer and study, or you got to read a book, and now your brain is tired at this point. Yeah. So it's like, oh God, I need you to really, really help me through this. Yeah. But God is awesome. He made it where I was able to be off for a couple of months. So, and I took advantage of that time. And really, really, really got into my studies and and my Remar virtual training. I love the way it is set up. I still use it before it expires. I still go in there and do stuff on there. It's because it's exciting and I do enjoy it. And so I've told so many people about it. I hope they go ahead and sign up because it is awesome. And it was a wonderful journey. It was hard, but the outcome is good. I was able to enjoy the holidays with my family.
Yeah.
And it felt so good. Oh my God, it felt good.
Oh,
So I just encourage anybody that's listening to stay focused. You can do it. God got you. Regina and Mark are such great motivators. So you guys encourage so much till I can, I will, I must pass Nclex. I use that on everything now.
Yeah.
I can, I will, I can do this because with God, all things are possible. So yes, I'm excited, and I'm excited for anybody that's doing this at this time to just stay focused. You can do it, and you got this.
Wow. I didn't even have to ask you any questions. Not one question. You just answered all the questions that I would have asked you.
Wow.
Except for one question. Well, I guess you answered it too. Well, tell me what was your why? What was your why to keep going? Because after 15 years working as an LPN, that's that's a career. That's a career. Like, so what was your why to keep going through the difficult times of trying to study after getting off of work? What motivated you?
What motivated me was for all of the years that I had been an LPN, I had done everything. I started out in the hospital, did nursing home, did hospice, did home health. I've done a lot of things with this. And then I finally started doing case management. And with doing case management, the position that I hold as a member care coordinator, I wasn't able to move to the next level. And I wasn't liking that. So I'm like, I gotta do something. And along with, I have a friend that I went to school with. She's always been motivating and pushing. Come on, let's go to school. Let's go to school. Come on, come on, come on. So I went on back to school on those two notes, and it was hard. And I promise you, I was quitting every month.
Yeah.
Every month, I'm not doing this. This is not for me. I can't do it. I promise you, I stuck in there. One time I was all the way to the verge, to the instructor talk to me and say, it's so rewarding at the end. Just hang in there.
Absolutely.
And I'm glad that I did.
Yes.
So that's motivation, wanting to step to another level. And I also had others encouraging me not to quit.
Awesome. Thank you so much for taking time out of your busy schedule to be with us here tonight. I really appreciate you being here.
Students are watching this and they're asking, like, how do I get the virtual trainer? And so if you're looking to pass Nclex and gain the confidence that you need, and you want to study directly with Regina in a one-on-one way, just watching her videos anytime you want, going over your workbook and doing the same program that these amazing nurses have done to pass Nclex, just go to remarnurse.com. Right now, it's on sale until January 1st with the 7-day of Nclex event. But honestly, anytime that you get the virtual trainer is a good time because it's going to help you pass Nclex and advance your nursing career. One thing that I love that Nurse Lita talked about was that she says she still goes into the virtual trainer even after she passed Nclex and still does some things in there, which tells me that she finished before the 3 months access time.
Wow.
So when you order, you have 90 days, 3 months. She did the program, finished it, and still has extra time on the clock to go back in.
That's true. So me and her are probably the only two nurses that do that. All right. Okay. We have Nurse Brenda. I want to talk to her too. I have some questions I want to ask her. Thank you guys so much. Nurse Valita, don't go anywhere. I have something special for you as well. All of you guys, we have a big surprise that we're going to give you. Okay. All right. Hi, Nurse Brenda. How you doing?
Hi.
How are you? I'm doing good. How are you?
Good. I'm excellent. Relieved.
Yes, I can imagine. Talk to me about how the virtual trainer helped connect the dots and get you over the hump to passing your Nclex.
It was the structure. the organization of the program, the content. Oh my God, the content was amazing. I realized how much I didn't know.
Yeah.
Yes, it was excellent. I actually went through the virtual trainer twice.
Nice.
Well, I saw you said that you actually, because you worked, you had an alternate schedule. So you actually studied Monday, Tuesday, and Wednesday, right?
Yes. Yeah, because I worked 14-hour shifts. Yep. And I did that on Thursday, Fridays, and Saturdays. But the virtual trainer, I did it Monday, Tuesdays, and Wednesdays. Yeah. And I would throw in.
And I love that.
Saturdays.
And sometimes on Saturdays. And I love too, because it's like you really took the program and made it your own, like a lot of the other nurses, like nurse Alexis had to do. Like you guys, you had to make it fit into your life.
Right.
And I love how, sometimes if you take a live class for an Nclex review, then you only have like those 3 days or 4 days that you have the review. Right. If you have a book, then it's kind of like, well, it's just a book. But with the VT, you have lectures and books. And so if you just take the books or if you're watching the videos, you still get it done. And so I'm glad that you're an example of somebody who had to work and still get it done.
So motivational. You are amazing. Like you motivated me so much and pushed me to the limits.
Yes, I like that.
Yeah.
Yes.
What was it like completing your VT workbook while you were watching the lectures?
Oh, I would get frustrated sometimes because I would go through the content and do the questions, and it's like, no, you failed. So I was like, oh my God, I gotta do it. So yeah, it was a little frustrating in the beginning, but in the end, when I started really getting the content, it's like a challenge. It was really good. I really, really liked the program. I started out using UWorld. I mean, I'm not saying anything against UWorld. I mean, I learned, but it was like yours was so structured. It helped me really know the content to the extent that I needed to know it for Nclex test.
You know what? Honestly, even if somebody is using UWorld, it's still best to get the virtual trainer because your scores in UWorld are going to go up once you have that, that content knowledge. And when she said she would do the questions and it would just be like, no, you failed.
Yeah.
I think she's probably referring to like that 95% moving, like success rate to move forward.
You have to get a 95 or the virtual trainer won't let you move on. Yeah.
Right. Yeah. You can't. 80% is not good enough.
No.
90% is not good enough.
No.
99.5 won't do.
They're like, you have to go. And I think it's a mental training. Because when you're in there taking the Nclex exam, you have to be tough and you have to be able to think under pressure. You know what I mean?
So much pressure.
Yep. And so I know the virtual trainer puts that pressure on you from the beginning.
Yes.
Puts that pressure on you.
I needed it because when I was taking my test, I'm not one of those people that can sit here and say, oh, my test cut off on 75 or 60. I went the whole 9 yards, 125 questions.
Okay.
So I took my breaks and everything. I think it came to a point where you get so nervous, like, oh my God, I went past 75. This person went to 80. Oh my God, I went to 90. Oh, it's 100. So it's just like, you have to just stay focused, take your breaks, take a breath and keep believing no matter what the number is.
Yeah. That's a word for somebody too. That's you go in there being prepared to take the whole exam. And part of critical thinking is being able to sit there when you want to run out, when you get tired, being able to sit there and persist in the difficulty. That's critical thinking. That's critical thinking. Oh, thank you. Thank you so much for coming on tonight and sharing your story. Thank you.
Well, I have a testimonial here.
You got testimonial?
There's Jazzy J.
Okay. What did Jazzy J say?
Because I used the virtual trainer and QuickFacts.
Yeah.
First time taking Nclex, and I passed on my first time 2020 LVN. Thank you, Regina. Thank you for your motivation. I can, I will, I must, and I did pass Nclex. Awesome. Congratulations on passing Nclex. And you know what? Because you dropped your testimonial, because you're showing love, we want to also give you a copy of Regina's first shift.
Oh, yeah.
Because now that you've passed, it's on to the first shift working on the floor in the Sheets book to help you dominate.
Let me tell you some of my favorite chapters. So every chapter starts with dominate. So it's like dominate the job search, dominate the interview, dominate the job interview is one of my favorite chapters because as a registered nurse, as a travel nurse, I did so many job interviews and I picked up on a lot of similarities between every interviewer for nursing. So definitely, if you get the book, definitely read Dominate the Job Interview and also Dominate Your Orientation Period and Your Patient Assignment. Those are chapters 7 and 8. Those are my favorite chapters in this book.
Nice.
So,
Jazzy, do us a favor, it's a screenshot to support
you'll get
remarkreview.com. And we will send that out to you right away, Regina's first shift book. Congratulations again on passing Nclex.
All right.
And the cool thing is she did it on her first attempt.
Yeah, that's
you know
really cool.
So we have a lot of repeat testers in the Remar nurse family, and we absolutely love our repeat testers. But also we have nurses that are studying while they're in school, passing Nclex, first time making it happen. Shout out to you guys. All
right. I got another Nclex question. Here it is. Let's go. Let's go, Remar nurses. We've been hanging together. It says here, the nurse in an outpatient clinic is supervising student nurses administering influenza vaccinations. The nurse should question the administration of the vaccine to which of the following clients? Is it number 1, a 26-year-old female who is allergic to shellfish? 2, a 26-year-old female who says she has a sore throat? 3, a 26-year-old female who says she lives in a group home? Or 4, a 26-year-old female who has congestive heart failure? What do you guys say? Who is the inappropriate client for the influenza vaccination? What do you guys say? Oh my goodness, I see a lot of 1s and a lot of 2s and a lot of I'm nexus and number 3s I'm nexus. Hey. Hello. Hey, you guys, this is the Remar Nurse Success Party. We're here with Remar nurses. I'm about to give their big giveaway. They don't want to miss it. You guys don't want to miss it. After this question, I'm going to reveal the answer and reveal my big surprise for them. All right. The correct answer, Mark, you ready for the correct answer?
This is our 5th and final?
Yes.
Okay, so what are we going to get?
I don't know. I don't have anything less to give. I don't know. What are we
going to get?
I don't know.
Let's see.
What do you have?
All right, so we did 25.
You did 50.
Did 50. Where can we go from here?
I don't know. Did you get my Christmas present yet? Because I'm still waiting for it.
You said you wanted that thing from that one person?
I do.
Oh, wow. I don't know how much that is. Let's see. All right. Let me see the answer. What are we going to give? Okay. I see. I'm next.
Do you know what the answer is?
I do.
You do know
what
this one is?
Answer.
Oh, okay.
I know. No, I looked at the question.
Okay, so you know the answer.
I did my strategies, and I did the decision thing.
But I don't use none of those. We don't use strategies or decisions, so it's probably wrong. All right, let me tell you the answer.
I just looked at the screen.
Okay.
All right. So like, we're about to give away. We're going to give away.
You said you used the decision tree. What? Come on, man.
That's what they be saying. Like, you got to use some things, right? All right, here we go.
Stick to the content.
All right, stick to the content.
All right.
All right, here we go. In fact, let me see.
All right, I'm gonna show the answer. Wait. Okay, come on.
Wait. All
right, here we go. This is the question. I'm showing the question.
All right, question.
And then the answer.
Answer is.
Okay, there it is. Okay.
Got it.
Nurse Nicole. Hi. You got it right. It is number 2. Hey, you guys, remember with influenza, if a client has any kind of respiratory illness, any kind of sickness, runny nose, cough, sore throat, they at that time should not get vaccinated. All right. So typically for Nclex, you're going to see when it comes to influenza vaccinations, you're going to see patient has a cough, patient has a sore throat, patient has a runny nose, and they'll put in a whole bunch of different distractors, and they're hoping you go for the distractors. Like a lot of people picked allergic to shellfish. That has nothing to do with it. All right. So the Remar nurses were like, Nurse Brittany, like, that had nothing to do with it. But no, so it's correct. It's number 2. And did you say what you were going to give away? You never said what you were going to give away.
I'll tell you what I'm going to give away.
What?
I'll tell you what I'm going to give away. All right. What I'm going to do is, so Nurse Nicole, I'm hoping that you are studying with Remar, that you've invested in yourself. You're getting the virtual trainer during this event.
Yeah. And
so if you get your VT during this event, what we're going to do is we're going to give you $100 back off of your purchase for the VT.
Oh, wow. Perfect. Okay. So
contact support. Let us know that you got it.
Tell them Mark said it.
Screenshot this.
Yeah.
All right. And then you'll get $100 back on your virtual trainer order if you already have it, or if you order during the 7 Days of Nclex event.
Yes. All right. For one right answer. Wow.
That's it.
That's investing in yourself.
We want to encourage you guys and let you know, honestly, these are just tokens of love to let you know that we support you. Whether you won an individual gift or not, we want to support you as your instructor.
Yep.
And I support the instructor in supporting you.
Yep.
So whatever we can do, hosting the party and bringing these other nurses on to let you know that you're on the right track. You can, you will, and you must pass Nclex.
Yes. And so all of our nurses, we're going to bring them on. Thank you guys so much. And because you spent some time with us. Okay. And because you spent your busy time with us tonight, Mark and I want to tell you that the best gift that you can give is investing in yourself. And you guys did that by purchasing your VT and studying and working very hard. So what Mark and I are going to do is we're going to invest back into you. So whatever you paid for the virtual trainer, we're going to give that money back to you and allow you to sow it into somebody else or sow it into yourself and just go into the 2 years with your with the money that you invested back. So you guys deserve it.
Thank you.
Thank you. It's yours.
This tough decision of investing in yourself, you guys made the difference.
Yes.
But honestly, you came back and you're encouraging somebody else to get their license.
Yeah.
In fact, some of these testimonials, I promise you, I was about to cry. I just stopped just short of it. I said, hold on, Mark, be strong.
Oh,
Mark.
man.
But I guarantee somebody else was watching and shed a tear because it's so real of the impact that it's had on your lives and your children. And your families, and we want your career to be a blessing to others,
absolutely,
to your patients, and so that you guys will also have a career of giving as well.
Yep.
Oh, thank you.
Thank you so much.
Thank you.
Happy holidays to you guys. And Mark and I, we just want to say that we pray that 2021 is going to be even more incredible and successful year to you. And don't forget that you're Remar nurses now, so you have the responsibility of loving and nurturing and bringing somebody into the nursing profession. That is our calling. We want to do that. Nursing is one of the most incredible professions you can have. Literally, you guys know you can do anything. You can do anything as a nurse. You can do anything as a nurse. And so I'm very proud and excited for your future.
Thank you so much.
Thank you, and God bless you guys.
Thank you.
God bless you guys too, and we will see you later. But before you go, you got to say it. You know our motto. You know our motto and our marching orders. So on the count of 3, we're going to say it. For those of you who want to say it with us, this is what we say here at Remar. I'm not even going to tell you because I know you guys know it, right? On the count of 3, we're going to say it. 1, 2, 3. You Yes, praise God. And you guys did pass Nclex. So yes, congratulations, guys.
Right now, we are doing the 7 days of Nclex every night now through January 1st, studying directly with
All right, guys. So we will see you later. Have a good day. Remember day 2, 7 days of Nclex. I hope you can join me. Don't miss it.
What time is day 2?
Day 2 is at 8 p.m. Eastern time. So if you're on the West Coast or on the East Coast or in Africa or in the Philippines, make sure you get 8 p.m. Eastern time right here at Remar Review. All right. And you can join us from Facebook. You can join us from YouTube. We will be streaming live and it's for free. So bring your workbook and get into the Nclex success here that we have for you guys. Thank you so much.
The content that you need to pass Nclex at remarnurse.com.
Bye-bye.